Hello and welcome to National Khabar. I'm Shweta Ranjan, and today morning we have with us a senior doctor, a microbiologist, senior consultant with the Metro Hospital, New Delhi. She is the one who's dealing with the people who are providing their services at the front line against COVID-19 fight. So, Dr. Handa, you have arrived. You are here in the show. Welcome to the show.
Thank you, Shweta, for such a warm and wonderful welcome. Good morning to you and plus all the viewers. Thanks for such a wonderful morning.
Yeah, so Dr. Handa, you are dealing with people in the front line mostly, being a microbiologist. Um, Firstly, we would like to start with the suggestions that you would like to provide to the people in the front line, like the police officials, police people in forces, people like nurses, doctors, who are in direct contact with the patients. What are your advice to them?
First of all, we have two categories right now. What are the first category who are in direct contact with the patients, right? Who are working on the front line, who are dealing day to day, they are dealing with the patients. They are the frontline doctors, nurses, housekeeping staff, which are so they need to use the PPE, personal protective equipments, which they are already using it. But major problem is with the police, the police workers who are and especially the media people who are again in contact with the people who may come positive, because nowadays we are taking every person, because you don't know the status of the person. Any person can be positive. So you need to take precautions before dealing or before coming in contact with the people. So I'll talk about the the working people in media, police. I've seen them wearing masks, but the mask appropriate, they are not wearing it appropriately. Like, you need to cover your nose, and then you need to cover your mouth. So they are wearing the mask which doesn't cover their nose, and it is like they are wearing the mask below their nose, and it is not obviously the it is the aerosol transmission. So you need to wear a proper mask, and they can the direct contact with the patient, who are direct in contact with the patient. For them, N95 mask is good enough, and you don't have to sterile the N95. You don't have to clean the N95 if you're using if you're reusing the N95 mask. So main protocol what we are following is, you need to keep the N95 in a simple paper, and then just keep it in a dry place where no humidity is there. So you after 72 hours you can reuse the same N95 mask. So you need to have two or three masks, so that at least you can wear those masks in
Yeah,
rotation.
I was going to come to this question because, to organize this session with you, the
Yeah.
purpose, the motto behind was mainly because I have so many media friends. They are going into the field, dealing with people, reporting, and doing the coverage. And as it is, Prime Minister Narendra Modi ji ne bhi kaha hai ki people have to be provided uninterrupted services. News media people should continue to work. तो ऐसे में क्या होता है कि दे आर इन डायरेक्ट कॉन्टैक्ट. बट
Yeah.
क्या आप सिर्फ इतना ही जानते हैं कि आपको मास्क यूज करना है, या उस मास्क को कैसे, किस तरीके से, कितनी बार रिपीट कर सकते हैं, कौन सा मास्क यूज करना है, ये सब जो बातें हैं ये जानना बहुत जरूरी है. सो दैट इज व्हाई आई थॉट जो मीडिया फ्रेंड्स मेरे ये न्यूज को देख रहे हैं, ये प्रोग्राम देख रहे हैं, प्लीज कम फॉरवर्ड, प्लीज आस्क योर क्वेरीज. आप अपने सजेशंस लिखिए, कुछ भी पूछना चाहते हैं, जानना चाहते हैं, आप लिखिए, ताकि आपके मन में जो भी क्वेरी है वो हम अभी क्लियर कर सकें. जी डॉक्टर, आप कह रहे थे आपने देखा है कई मीडिया पर्सन्स को भी कि वो मास्क
Yeah.
प्रॉपर्ली नहीं पहनते हैं, इवन
Yeah.
देयर हेड.
Yeah, because I've seen many media people, and plus even at working even in the banks, even banks are open. Anybody working, first we need to keep in mind social distancing. Second, mask, and the type of mask you're wearing, right? Media people, maybe they are going in such a red area, which is completely red code, which is completely locked down. So you need to take precautions while going in that area. You need, N95 they can wear, or if they are wearing a three-layered mask, right? That should be properly, they should wear that mask properly. That should cover your nose and plus your half face, right? Secondly, they need to tie their hair. I've seen all many people, they are like, open with, coming out with their open hair and all. Why? Because obviously the hair can irritate your face. So you have the tendency to, touch your face again and again, right? So better is when you're tying your hair, so you don't have to touch your hair, and plus you don't have to touch your face again and again. So there's less of the contamination, less of chances of
So you
infection is
mean to
there.
say along with mask and gloves, the
Gloves.
head should also be covered?
Covered. I'll come to gloves later on, but I just want to clear it. If they can't, wear a cap, obviously they are like roaming around, and like, they are going to different places. They have to be presentable as well. So they can just tie their hair with the nice pins and everything, so that the hair doesn't irritate their face. So they don't have to itch their face all the time, right? Second thing, when you're like, going out, wearing gloves is more important. Why? Because wearing gloves, then again, you don't have the tendency, because you have that message in your mind, you're wearing gloves. So with that, you won't touch your face, you don't touch your, any, hairs and any part of the exposed area. So
Mhm.
that is very important again. And secondly, I'll suggest, if you're like going to your workplace, so you need to carry very less of the stuff, like, just you don't have to carry a big bag. Just limit your stuff whenever,
Bare
because
minimum, bare minimum.
bare minimum stuff. Because when you're coming back, you can't sterile, you can't disinfect your bag every day, which is not possible, right? So when you're going out, so you need to carry one, if you need a pen, you carry a pen. You can, nowadays people have started avoiding transaction in, cash and all. People are like, preferring online and everything, because again, with cash, there's like, source of infection is again there. So you avoid carrying cash or like dealing in cash. But still, if you're like prefer, so whenever you're touching the cash, so it is very important to sanitize your hands again and again whenever you're touching your cash, right? Or you're dealing with the cash. And secondly, third, and try to just avoid wearing all metal stuff, on your body, like, the bangles, rings, and like, watches people are wearing, because every time you're going back, you can't wash your, sanitize your watch every day, right? So bare
Mhm.
minimum stuff you need to carry at your workplace. That would
Right.
I'll suggest.
I will include one question that is being asked by the viewer. He's Mr. Karunesh Arya. He writes, for how long surgical mask can be used? I see people using it throughout the day.
Okay.
So the
Very
duration.
duration, very good. Surgical mask, if you're not in direct contact with anybody, so surgical mask, you can reuse it, but the whole day, if you're going out, right? So, and plus you're going, so if you're keeping it for untouched for 24 hours, that is good enough to reuse it again. So like, you can keep in the sun also. That is like, now we have such a good temperature, so it is
Mhm.
very good. So like, you can reuse it, but not more than 2 or 3 times.
Okay, so we
And
have an.
you are, one more thing, you can use the house-made, what do you say, mask and all, which is like easily available. That a mask you can wash also. I mean, which is like,
I wanted to come to this question because there is a lot of promotion happening of the mask being made at home. So is it
hmm
as good as the one that we can purchase from the market? How
The
effective?
effectiveness, you can say N95, they have the 90% of, the protection. Again, surgical mask is like, proved to have like, equal efficacy about like, protection against the virus. But when you're using, housemaid, because they are not in direct contact with the patient or any contact with the, person, because again, they are like making, they are maintaining all the social distancing. They're just going, I mean, normal people, they are like going for the, buy grocery or like, stuff like that. I think so for them, they can use it. But and
So
they
you
need to
mean
sterile also. You need to, wash it, and you need to maintain that sterility also with the mask what you're wearing.
okay? So suppose a person is using a house-made mask and is moving around only in the area, very limited area, for you can say that to buy groceries and maintaining social distancing. So this is wearable and usable and it is effective. But at the same time, if a person is needed to go to a hospital for a visit or to consult a doctor, it is an emergency, you don't advise those masks to
No,
be
then
used.
I won't advise to wear a house-made mask. That is, and again, you can test your mask also. Nowadays, I mean, even the video was very viral. So whenever you're wearing a surgical mask, you can just keep a lighter or a candle. You just need to blow it. And if the candle is like, you can blow the candle. So your surgical mask is not effective. If you can't blow the candle, so your mask is effective.
So this is a brilliant thing that I would like to tell my viewers कि आप अपने मास्क को घर में भी चेक कर सकते हैं कि वो इफेक्टिव है कि नहीं. So अगर तो आप मास्क पहनने के बाद suppose you are holding a candle in front of your mouth and आप उसको blow कर पा रहे हैं तो आप ये समझ लीजिए कि आपका मास्क जो है वो effective नहीं है. अगर वो blow out नहीं होता है, that means it is effective enough and it is you advise it to be used. So we have another question. Let me include that. The question says, what about moving in elevators? Any special precautions one should take as we still need to press the button and stay in lift cabin for a minute or so. So during that 1 minute thing in the lift cabin, what should be done?
Very good question. When you're using the same lift, like, it differs. Like if you're staying in a society, obviously you can't avoid using the lifts. So just try to, if you're wearing the gloves, you're carrying your sanitizer along. If you're just, otherwise, it is like always preferred to keep a toothpick with along. So directly you're not touching the buttons, right? You're pressing the buttons with the toothpick, right? Or you can have a pen. So you are pressing the button with the pen instead of using your direct hand or any finger of yours. And just try to avoid, standing with more of people in the lift when you're using the lift. So that is main reason, the main precautions you need to take while using the lift. And by any chance you don't have pen or anything to, support, and you are using your finger or your hand, so you just need to sanitize after using the button, because many people, they must be using the lift with the same contaminated hands.
Right. So another question, Karunesh has been asking very valid questions. That's a very pertinent point. We never thought about ornaments. Great point.
Thank you.
Okay. So Rudraksh writes, Namaste doctor, very valid points. We all must follow and stay safe.
Yeah, stay safe.
Another question, Ashutosh Shekhar writes, good morning, Dr. Handa. Your advice will certainly help us to secure us in a better way. Thanks a lot, doctor. So the viewers have been joining and raising their concerns, asking their questions. Doctor, one question which is very often asked, and one needs to be very, very careful about this thing, that when you can't live without eating. So you are definitely getting the groceries home. अब वो जब आप groceries घर लेकर आते हैं, what are the steps, basic steps that one needs to follow and do to keep the disease at a distance?
Very good question, Shweta, I must say. Why? Because nowadays I've seen people coming with groceries and, first of all, again, I'll remind you, whenever you're going out, you need to wear a mask. Second, social distancing, which is very important, very, very important. Third thing, when you're going there, you don't have to lean on the surfaces. Like you just lean on the walls and while waiting and all, you just touch their surfaces. Because on surfaces and plus, anywhere it can stay for hours to days. So it's a new virus coming up. So exactly nobody can say right now. So you need to take precautions for that also, touching anything there. So when you're going there, try to wear gloves as well. Okay? And secondly, when you're coming back, you need to wear a footwear which covers your feet completely. So when you're coming back from after buying the grocery, you need to change your shoes, which is very, very important. First thing. And just keep a different slippers or any footwear different for the house, right, when you're coming inside your place. Secondly, when you're very important, you asked me, when you're buying the grocery, you're buying all the because you have like more chances getting your you maybe carrying the virus along. So you need to be very cautious with the formites, right? So whenever you're buying the grocery, first thing, the poly bags. So you need to discard immediately the poly bags. Fine, whatever you're buying. And when you're buying the grocery in your like in the packets or packed, you need to clean it with normal any disinfectant, like sterilium. You can clean it, the the packed stuff. You don't have to wash it everything with soap and water, especially the food products. I've seen people buying fruits and vegetables. They're washing those fruits and vegetables with soap and water. Soap and water is not meant for like fruits and vegetables.
Of
You
course,
can,
yeah.
yeah. So the people can end up with diarrhea, bowel
Mhm.
irritability, diseases like that.
So
So it is like,
the packed products can be washed. Uh,
yeah, you can wash because obviously you can avoid the water going inside. If you're like, more hygienic, you just need to keep it more clean and all. So otherwise, you're just dipping it like, hanky dipped in a sterilium or like, the sanitizer, alcohol based sanitizer. So you can clean the packed stuff with that also. That is good enough. And when you're cleaning your fruits, when you're cleaning your vegetables, so best I'll recommend, even day to day, that really helps for pesticides and all. So you need to dip in potassium permanganate, or vinegar will do, sodium bicarbonate will do. But that is like, I think so, salt water again, it is very good for washing your fruits and washing your vegetables. You don't have to wash them with soap and water. Kindly, please, big no for soap and water.
yeah. So we have another question. Does reheating food which is delivered, suppose a person is delivering, you are ordering food from outside, and will the reheating help?
As it is, the person main is the person who's getting the food, right? The food is obviously the food is completely cooked. Main is, I told you, as I told you earlier also, the main is the formites, right? The person, maybe the person is infected and he's touching all those bags and the packed stuff in which you're getting the food. If you're just separating the food in a separate bowl, you can just reheat it. The food is not contaminated because the temperature is so high. So the virus is not active after like 60 degree of temperature.
But suppose you're ordering a pizza. So do you need to remove the pizza box outside the house? Firstly, discard it outside the house and just get the food inside.
Yeah. First thing, Shweta,
Because
nowadays, so we
see, if
won't
you're
get, yeah.
the food you can reheat, but the carton that it is coming in, the carton can be carrying the virus.
Mhm. Yeah, that's what I'm saying. Those are the formites. So you need to be very cautious. The other person, whoever is touching the stuff, so it may contain virus. It may be, carrying the virus. So which is more important to discard those things. So reheating the food or reheating anything is no harm, I believe.
Yeah, we have another question. Also, do you advise not to get the footwear inside the house? I think we have addressed this query.
Yeah, yeah, yeah.
A big no
Because
to.
yeah, big no for like carrying the same footwear inside, because you can't maintain that like hygiene, and plus that sterility inside the house every time. Okay, na? Right? You can't mob your floors, you can't mob your house all the day, right? So better is you just keep your outside footwear separate. That would I'll
Yeah.
recommend.
So, doctor, another concern is newspapers.
Yeah.
Like we have stopped using the currency and we have gotten into the habit of using the card and not using the currency notes as such. So, newspapers can be the carriers because
Earlier
they
like
are saying at the same time that newspapers are safe.
safe, yeah. But again, we are dealing with the currency also. It's all, that's what I mentioned earlier also, Shweta. It's a new virus. So every day you are getting some or the next, theories about it. Earlier it was mentioned newspaper do carry, like, because obviously it is coming from different hands and a different source. So maybe it can carry virus also. So now I think so easily e-papers and everything is available on, like, net and everything, so you can go through it. So I think so avoiding paper right now is better.
So, since you're dealing with people in the front line, being a microbiologist, do you think people who are providing their services are also going through a lot of stress at the
Yeah,
same time?
that I must say, very good question. Because as a medical person, and plus nowadays we have a different type of stress. Why? Because daily you're dealing with such patients, daily you're dealing with such scenario in the hospital, and plus not only the medical people, right? Like, media people. They are like again on the front line. They are like, you're sitting calmly at your place and you're getting update news and everything. I really appreciate them. Second, the police people, like, I think so tension is among everybody working right now. The disease is, I think so, more panic is there than the disease, right? So I'll suggest getting panicky, and plus, the more of anxiety and all, one should relax and, like, try to indulge in different, things like, meditating and all, so that it just calms you. And plus, at least people are coming again with like, doctor साहब हमें covid तो नहीं हो गया, हमें covid तो नहीं हो गया. So like if they have a normal cold also, so they are like, thinking about covid, right? So panic is more among the people. Medical staff, obviously they are going through a different picture, you can say.
Mhm. So another question, which is very similar to what I asked, but it has a different um, angle to it. Can I include this question? Issue is elderly people who need their newspaper. Hence, can some extra precaution be taken since they are into the habit of holding the newspaper in a physical manner and reading it? They are not. They don't have the habit of going
E-paper,
on
yeah, I can
e-paper.
understand.
So.
Yeah, I'll recommend if you're using the newspaper, and plus, then if you're following the proper regime for sanitization, then I'll say ki you can take the newspaper also, and plus you can read the newspaper. But what is like more important, you can keep a different. What I'll recommend, it's my personal experience. Like, even I have elderly people at my place. So what you can do, I mean, you can keep a separate sheet where you're reading it, right? Don't keep on your laps, don't keep on your, like, anything which you're like, sitting there. So you can just keep a separate sheet. You can just read the newspaper on it, and after that you can just sanitize your
or
hand.
maybe or maybe keeping the newspaper in the sun for a few hours will help
Yeah,
disinfect
that
it.
is good enough. Now we have good amount of, like, temperature and everything. So
So
yes.
since doctor people like police forces and doctors, um, when they are into the field all the time, so do you suggest any special sort of exercises for them which they should be doing when they are in the field, or to keep themselves active and relaxed at the same time?
That's what I mentioned, I mean, main is like the mental relaxation should be there. Obviously, like, at this time, one should be very cautious about their diet, taking a healthy diet. Second, which is very important, exercising, which is like, person should be regular exercising, which is very important. If you can add it with, like, meditation, that is the mental relaxation a person can go through, right? Which is very, again, important, because the medical people and medical staff nowadays, they are dealing with such a stressful atmosphere. And plus, people are like, they are dealing with more of the negativity, right? So one should be like more positive at this point of time.
तो अभी जो नई गाइडलाइंस इशू की गई हैं भारत सरकार के द्वारा, मिनिस्ट्री ऑफ होम अफेयर्स ने जो गाइडलाइंस इशू की हैं अंडर लॉकडाउन 2 सीजन, कि 20 अप्रैल के बाद से जिन लोगों को थोड़ी छूट दी जाएगी, कुछ सशर्त छूट होंगी कि आप अपने मूवमेंट कर सकते हैं, तो उसमें जिस जैसे गुड्स कैरियर्स, कुरियर्स, और बहुत सारी चीजें हैं, रेल और विमान सेवाएं तो उपलब्ध नहीं है, लेकिन वो गुड्स के लिए हैं। तो ऐसे में जो सर्विसेज शुरू होंगी, या किसान के लिए, क्योंकि उनको राहत दी जाए, गरीबों के लिए, लेबर वर्कफोर्स,
Yeah.
जो लोग अपने अपने घर वापसी किए हैं, उन लोगों के लिए काम की सुविधाएं थोड़ी दी जाएगी। उनके लिए स्पेशली अभी आप क्या सजेशन देना चाहेंगी, सिंस द मूवमेंट विल स्टार्ट आफ्टर 20th of April? तो व्हाट आर द सजेशंस you would like to give?
Again, what is like the main important thing is social distancing, which is the uttermost important thing. Even nowadays, also, who like the people are working, they are going day to day basis. Even they need to maintain the social distancing. First, when they'll go out, social distancing. Secondly, whenever they are coming back, which I really mentioned, I mean, like whenever they are coming back from their work or like any place or any working station, so they need to sanitize. And plus, when they are at their working place, they need to sanitize their hand again and again, so that because it is a human tendency, you can't avoid touching the surfaces, you can't avoid touching the objects nearby, right? So the main is like maintaining a proper sterility. I mean, like, proper hand hygiene, proper, like, you're wearing a mask, and plus keeping a proper social distancing, wearing full sleeves, clothes, and using such a material so that it is very easily to disinfect. Daily, you need to wash your clothes when you're coming back from the workplace. And taking, which I really, I think so, missed out telling you, when the any person coming back from the hospital or working place, like media people, police people, anybody, which is very important, they need to take bath daily from head to toe, what come may. And secondly, whatever, and when you're using your mobiles, you can use a zip lock for using the mobiles. I think so you can use your mobile from the this thing, polythene, right? From the above, like, you can use your phone, which is the touch screen. You can use your touch screen from the
There
ziploc.
are phone covers also which
You can't
allows
uh,
them.
yeah, but Shweta, you can't sterile, you can't throw the phone covers daily. So if you're using
Oh
a
yeah,
poly bag, or if you're using a ziploc, so daily you can discard that,
something you can discard daily.
yeah, and you can wash it and you can reuse it also, right?
So
So
one question that comes in my mind always when I am setting the clothes for into the washing machine for a wash, um, the clothes which are used by the person who has moved out of the house, should they be washed with the people who are the clothes of the people who are inside the house?
yeah, it won't matter, because when you're washing the clothes together, obviously, and that must be if you're coming from out, like, if like if I'm coming back from my hospital, so I prefer keeping my washing my clothes separately, because I'm coming from a place where is a high rate of infection, right? So when a when you people are going for grocery or like anywhere else, so you can wash your clothes together. I mean, there's no harm, but on a high temperature, when you're like using your, and plus when they are exposed like in the sun for more than 24 hours, I think so 6 7 hours is good enough.
So we have a very, very valid question, which we tend to ignore most of the time, and this will certainly help us. A lot of people having throat pain start with antibiotics. As doctors advise them to wait, is it advisable for those people to self-isolate as there are
Yeah.
different symptoms, but they may be affected, and waiting for 5 days to see effective antibiotics? Should they start with antibiotics and isolate and then?
Yeah, well, like if you have any contact history, or if you have any history of like when like with the COVID patient, or like if you're going out regularly, of like like if you are in police, you are like media people or the medical staff, so obviously then you need to isolate yourself. But regularly, if you're sitting at your place and you're not exposed to any like person who has COVID, then I don't think so you need to take any like of the medication. But yeah, self medication is always not recommended. You don't have to self medicate yourself. You need a proper guidance, you need a proper medical person to take the medicine.
So one shouldn't just start with antibiotics.
No, 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 no. You need to, antibiotic is Shweta, when you have any symptoms for taking antibiotic. Betadine gargling is good enough if you have a sore throat or anything. If you don't have fever, you don't have any other symptom like that, why to take an antibiotic, right?
Okay,
So
there's a lot of confusion regarding turning the AC on also. Uh,
yeah, very good. Yeah,
yeah, people are saying that one has to, till the time one should ignore, avoid using ACs and staying in the cool temperature, and using the refrigerated thing. Will it help somehow to stay away
avoid
from the disease?
avoiding the AC.
Yeah,
No,
yeah.
it is not. I mean, no scientific evidence is there for, like, you'll have COVID with the AC, right? So people are, we have the window ACs. We are not dealing with, like, any COVID patients or nothing. There was like study in Singapore, I believe. There was the viruses was found in, like, the air duct, which the AC air duct. Fine. But again, like, we don't have any scientific evidence about it. So I think so ACs are, like, good enough to use it. There is no harm in using the ACs. It's again a myth.
So,
I mean, like, yeah.
yeah, so do you advise eating cold things at this hour, like ice cream and other things which are cold?
Yeah, I
Because
mean, it is, I mean, like, it was, the virus is not there in the ice creams, right? The food products, it does not carry the virus. You can have ice creams, you can have everything, but the main, I think so, one should avoid, in the sense ki, like, if you have a sore throat, or, like, you have any, like, tendency of getting a throat, or getting, like, sick after eating it, but nothing linked with the virus as such. So it is completely safe to have anything right now. If you want to
yeah, but
have cold
also
milk,
eat food that can boost your immunity. That is what
yeah,
you
that
advise.
healthy and the balanced food, which is very important. And
Right,
exercise
doctor?
regularly.
That is
And
very, very important.
yeah, mental health is very important right now, because everybody is, like, getting more negative and panicky. And I think so, getting more positive is very important at this stage of time.
So डॉक्टर थैंक्स अ लॉट फॉर बीइंग देयर ऑन द
My
शो। मुझे
pleasure.
तो ये लग रहा है कि आपके एडवाइस बहुत काम आने वाले हैं सबके,
Thank you, Shweta.
बिकॉज जो भी मेंटल ब्लॉक या जो भी हमारे मन में कुछ क्वेरीज रह जाते हैं एंड वी डोंट नो, जैसे मास्क को लेकर ही आपने अभी पूरा एक्सप्लेन किया कि कितना सेफ है घर का बना मास्क, या फिर हम बाहर के मास्क ही यूज करें जो हम परचेज करते हैं, कितनी बार यूज कर सकते हैं, हाउ टू डिसइंफेक्ट, यू नो, फॉर व्हाट ड्यूरेशन शुड वी वेयर, ये सारी चीजें आपने जो अभी क्लैरिफाई की हैं।
Thank you.
Thanks a lot, doctor,
Thank you, Shweta.
for giving your
Thanks a
precious
lot.
time.
Thank you, Shweta. So nice of you.
It was lovely having you here on the show.
Yeah, my pleasure. My pleasure, Shweta. Thank you.
Karunesh, our viewer also says thanks to you because he is currently in Dubai, and
Oh, thank you.
he's been watching our show, and all the queries that there also is a complete lockdown. He's seated inside the house, so
Okay.
he's sorting out all his queries. So
Chalo,
thanks a
thank
lot,
you.
Karunesh
Thank
Arya,
you.
for all your lovely time and all your queries. Thanks a lot,
Yeah,
doctor.
thank you. Thank you, Shweta. Take care.
तो उम्मीद करती हूँ कि आपके बहुत सारे डाउट्स क्लियर हुए होंगे, क्योंकि हमारे साथ थी आज एक फेमस माइक्रोबायोलॉजिस्ट डॉक्टर नवजोत हांडा, जो बता रही थी कि पुलिस बल या मीडिया कर्मी जो लोग फील्ड में जाते हैं, डॉक्टर्स, उनको किस तरह की बेसिक केयर की जरूरत है, क्योंकि दे आर द मोस्ट एक्सपोज्ड वंस टू द कोविड-19 वायरस। सो आपको कैसे बच कर रहना है, कैसे खुद की इम्यूनिटी बूस्ट करनी है, क्या बेसिक प्रिकॉशंस लेने हैं, मास्क यूज करने हैं तो किस तरह के, सिर ढक के रहना है, या आप क्या बेसिक और प्रिकॉशंस ले सकते हैं, ये सारी चीजें डॉक्टर ने भी एक्सप्लेन की हैं। आप जरूर देखिए, सुनिए और अमल कीजिए। थैंक यू।